Thank you, Mr. Chairman. Madam Secretary, thank you for being here. As I've been working closely with my Democrat colleague Anna Eshoo on the BARDA reauthorization bill, I would hope that we could submit some questions for the record. It's very important to us. I know it's important to you.
That would be great.
And we'd look forward to working with you on that. In the 2013 budget, how many employees are dedicated and committed to getting the health care law up and implemented and coordinated with the states?
I do have those numbers here. If you could give me just a moment to make sure I give you the accurate number. We have 210 people in the division that is specifically working on exchanges, health insurance reform, and others. We have about another 146 working on the parts of the Affordable Care Act relating to Medicare and Medicaid, and then some department-wide folks who have picked up basically some of this effort. So about 800 people throughout CMS are actually dedicated to this effort.
Do you expect that number to rise in future budgets just for the implementation and management and regulatory administration of the health care law?
Again, this is an FY13 number that we are supporting, so it includes any increase that we're seeing right now. A lot of what we're doing, I think, is covered by the folks that we have.
Okay. So my concern was when the chairman went through and there's no federal state exchange rule, there's no, for states, excuse me, there's no federal exchange rule, there's no guidance and rule on what it is an accredited health care plan, nothing that outlines benefits. We have about 18 months. And my concern here is, and I understand what you've been saying, but we have insurance agents who have been a bastion for small business being laid off. Matter of fact, I had 150 workers at one company, 30 of which were in my district alone. We think there are thousands and thousands across the country because I think the medical loss ratio rule is wrong. We have a very bipartisan effort here to fix it. Can you commit to fixing that today?
We are following the guidance from the very bipartisan National Association of Insurance Commissioners. We adopted their rule on the MLR, and we intend to stay with their rule.
So it's okay that we're going to continue to lose these jobs, and we're losing them today, and we're going to lose more tomorrow, and these are the very people who are going to try to make some sense out of this massive set of rules that's only going to give them a matter of months before they are fined by the federal government. You understand why I'm concerned, I think.
Well, I think that there is a slight mischaracterization about our progress on the rules. We do have a proposed rule that is out, has been for months, on the framework of the exchange, on
but I understand
Medicaid.
That,
we have a very detailed
and
bulletin
to reclaim
on
my
essential
time, and I
health
get it,
benefits.
I've heard your answer on that earlier. That does nothing if you're the person who actually has to raise the money, sell the product, raise the money, hire the people. A proposed rule does nothing for certainty for me, nothing. And so here's I guess my point. It doesn't seem like there is any sense of urgency about what's going to hit these very companies who are fighting for their very survival. And the one sector of that was at least going to give them some guidance are now eliminated. The federal government, by that law and by your rule, eliminated these broker agents from even having the opportunity to show up at the small cafe and say, let me guide you through this before you get slapped with a $2,800 fine from the federal government.
Well, there is no elimination of brokers and agents, and having served as insurance commissioner, I can guarantee you that I think they are valuable folks.
That's great, except that they're losing their jobs today.
The medical loss ratio in no way eliminates brokers and agents. It didn't define broker and agent as health-related
so they are eliminated
costs.
through the back door. And Secretary, that's what concerns me.
Exchanges at any point along the way can...
We ought to at least just be frank with each other and admit the fact that these brokers are going away. Now, yes, the law didn't directly say you're going away. The impact of this law is they are going away. Very, very concerning. Let me get to the second part here. I won't have much time left. 30% of doctors, according to the AMA, have already said they're restricting the number of Medicare patients in their practices. 2/3 of physicians have looked into opting out of Medicare for treating patients. We see this huge cultural shift in the practice of medicine. They are selling to hospitals at an alarming rate. Costs go up. They are reducing the number of appointments per week for senior citizens, and they're stopping to take new patients. How are you going to stop this and fix this for the future? This is a disaster for our seniors, and it's something I hope you're spending a lot of time trying to get right.
Well, I think the best way to actually make sure that the 97-8% of doctors who currently have contractual arrangements with Medicare continue those contractual arrangements is a long-term discussion and actual fix of the payment rate, which over the last 3 years expires a week at a time, a month at a time, a year at a time. The President has proposed in his budget and paid for in his budget a 10-year fix for the sustainable growth rate. That is the biggest issue that I hear day in and day out from physicians practicing, is they don't know if they're going to get paid. Being a good payment partner for the 48 million Americans who rely on Medicare benefits, I think, is the most essential thing, and we would love to work with Congress to actually get that done long term.
I would agree with you on that. Also, if you talk to those doctors, the Medicare health care bill has made that almost impossible for them to survive.
The Medicare health care bill?
No, excuse me, the health care law, which is why you see this cultural shift in the way medicine is practiced. And I hope that you get a sense of urgency on this, because people are impacted today.